For millions of older adults, blood pressure medications are a daily part of life and a critical tool in reducing the risk of stroke, heart attack, kidney disease, and other life-threatening complications. But while these medications are powerful allies in managing hypertension, they can also become dangerous when taken incorrectly. Whether it's missing doses, combining them with the wrong foods, or making sudden changes without a doctor's guidance, even small medication mistakes can have big consequences, especially for seniors. As we age, our bodies process medications differently. Changes in kidney function, liver metabolism, and body composition all affect how drugs are absorbed, circulated, and cleared. That's why seniors are more vulnerable to side effects, overdosing, or unexpected interactions, even when taking prescriptions exactly as labeled. Unfortunately, many of the most common mistakes are unintentional. They come from good intentions, trying to save a dose, reduce side effects, or respond to a dizzy spell. Yet they can lead to blood pressure swings that put strain on the heart and damage delicate blood vessels. If you or a loved one takes medication for high blood pressure, this video is especially important. Today, we're walking through 5 common blood pressure drug mistakes that seniors must avoid. Mistakes that can turn a helpful treatment into a silent threat. You'll learn not just what these errors are, but why they happen, how they affect your body, and what to do instead. These tips are based on real-world stories, medical research, and input from pharmacists and geriatric care specialists who work with older adults every day. Whether you're taking ACE inhibitors, beta blockers, calcium channel blockers, or diuretics, this guide will help you use your medication wisely, safely, and in a way that truly protects your heart, not complicates your health. Let's begin with the first and perhaps most common mistake, the kind that can catch even the most careful senior off guard. Mistake number 1: skipping doses or taking blood pressure medications inconsistently. It might seem harmless at first. You're feeling fine, your blood pressure seems under control, and you think, maybe I don't need this pill today. Or perhaps you simply forget. Life gets busy, or you fall asleep early and miss your usual time. But for older adults, skipping blood pressure medication, even once in a while, can be a dangerous habit with serious long-term consequences. Blood pressure medications are not quick-fix pills. They're designed to maintain a steady therapeutic level in your body, ensuring that your arteries remain relaxed, your blood vessels aren't under stress, and your heart doesn't have to work harder than it should. These effects are cumulative and continuous. When you skip a dose, even occasionally, you interrupt this balance, often without realizing it. And since hypertension rarely causes symptoms in its early stages, you may feel fine even when your blood pressure is climbing to dangerous levels. When this pattern repeats, taking your pills some days and not others, your body is forced to constantly adjust. This kind of fluctuation can lead to rebound hypertension, a sudden and sometimes severe rise in blood pressure that occurs when your body, no longer under the protection of your medication, reacts with increased force. This sudden spike is particularly risky for older adults, whose arteries may already be stiffened with age and less able to absorb that sudden pressure without damage. Consider the story of Geraldine Knox, a 76-year-old retiree from Flagstaff, Arizona. For more than 5 years, Geraldine had taken her medication faithfully. But after seeing a few weeks of normal blood pressure readings on her home monitor, she decided to give her body a break for the weekend. That evening, she began to feel warm and dizzy. Her daughter, noticing her discomfort, used the monitor and found her blood pressure had soared to 178/96. The sudden spike scared them both. When she spoke with her doctor the next day, she learned that even a single missed dose could cause destabilization, especially in someone her age. Now, Geraldine uses a color-coded pill organizer and sets an alarm on her phone every morning. She hasn't missed a dose since, and she's not alone. According to the CDC, nearly 50% of older adults don't take their blood pressure medications exactly as prescribed. Some forget, others stop because of side effects. Still others assume they no longer need them when they feel fine. But the danger of hypertension is that it often works in silence, causing damage to the heart, kidneys, and blood vessels long before any symptoms appear. By the time a senior feels the effects of uncontrolled blood pressure, like dizziness, chest pain, or shortness of breath, the damage may already be underway. Another common misstep is trying to make up for a missed dose by doubling the next one. While this might seem logical, it's risky. Doubling up on medication can lead to dangerously low blood pressure, especially in seniors. Symptoms like lightheadedness, fainting, or confusion may follow, raising the risk of falls, injuries, or hospital visits. If you accidentally skip a dose, the best course of action is to take it as soon as you remember, unless you're close to the time for your next scheduled dose. In that case, skip the missed one and resume your usual schedule, but always double-check with your healthcare provider or pharmacist about the specific instructions for your medication. So how can you protect yourself? Consistency is everything. Build your medication into your daily routine. Take it when you brush your teeth, have your coffee, or turn on the morning news. Pill organizers labeled with days of the week are helpful visual reminders. Digital alarms on your phone, smartwatch, or voice assistant can nudge you gently when it's time. For seniors with memory challenges, family members or caregivers can check in regularly to ensure that medications are being taken as prescribed. And if you're struggling with side effects or feel unsure about why you're taking a certain pill, don't stop on your own. Talk to your doctor first. There may be alternative medications or dosage adjustments that can keep your pressure under control while minimizing discomfort. In short, skipping or delaying your blood pressure medication, even just now and then, can quietly undo the progress you've made. What feels like a small slip can turn into a major health risk. And remember, the reason you feel fine might be because your medication is working. Staying committed to it means staying committed to your heart, your independence, and your future. Mistake number 2. Mixing blood pressure medications with problematic foods or drinks. Most seniors are careful about taking their medications on time. They use pill organizers, set reminders, and rarely miss a dose. But what many don't realize is that certain everyday foods and beverages, many considered healthy, can interfere with how those medications work or even make them harmful. This is one of the most overlooked mistakes, yet it has the potential to turn a well-managed blood pressure condition into a serious medical episode. One of the most well-known offenders is grapefruit and grapefruit juice. Grapefruit contains compounds called furanocoumarins, which interfere with enzymes in the small intestine responsible for breaking down many medications. When these enzymes are blocked, the medication stays in the bloodstream longer than intended, leading to higher than expected drug levels. For calcium channel blockers, like amlodipine, felodipine, or nifedipine, this can result in dizziness, headaches, flushing, rapid heart rate, swelling in the legs, or even dangerously low blood pressure. The interaction is so strong that just one glass of grapefruit juice can affect how your medication works for the next 24 hours. Consider the real-life case of Linda Jacoby, a 79-year-old retiree from Naples, Florida. Linda had been drinking half a glass of grapefruit juice every morning for over 30 years. When her doctor prescribed amlodipine, she didn't think twice about keeping up her morning routine. Within a few days, Linda began experiencing frequent dizzy spells, swelling in her lower legs, and occasional chest tightness. She assumed it was just the medication itself, but when her physician reviewed her dietary habits, the grapefruit juice was immediately flagged. After she removed it from her routine, her symptoms resolved and her blood pressure became more predictable. But grapefruit isn't the only hidden risk. Leafy greens such as spinach, kale, and collard greens are rich in vitamin K, which plays a role in blood clotting. While vitamin K doesn't interfere with blood pressure medications directly, it can affect how blood thinners like warfarin, often prescribed alongside BP meds, function, making it harder to maintain a safe balance. For seniors taking both types of medications, the issue isn't about avoiding greens, it's about consistency. Sudden increases or decreases in vitamin K intake can throw off the delicate balance of their medication, putting them at risk for either bleeding or clotting events. Another lesser-known risk involves salt substitutes, which many seniors turn to in an effort to cut down on sodium. What they may not realize is that most salt substitutes contain potassium chloride, a problem if they're also taking ACE inhibitors, like lisinopril, or potassium-sparing diuretics, like spironolactone. These medications already raise potassium levels, and excess potassium in the blood can lead to muscle weakness, abnormal heart rhythms, or in severe cases, kidney damage. Even certain herbal products and teas can interfere with blood pressure medications. Black licorice tea, for instance, contains glycyrrhizin, a compound that can reduce the effectiveness of some drugs while causing the body to retain sodium and lose potassium. This imbalance can contribute to higher blood pressure, irregular heartbeats, and swelling, ironically working against the very medication intended to prevent these problems. So, what's the solution for seniors who want to stay safe while eating well? It starts with awareness and communication. Always discuss your diet with your doctor or pharmacist, especially when starting a new medication. Keep an updated list of everything you take, including supplements, herbal teas, and over-the-counter remedies. When in doubt, ask questions like, is it okay to have grapefruit with this medication? Or, should I limit any types of food while taking this? You don't necessarily have to give up the foods you love. In many cases, it's about timing, moderation, and consistency. For example, if you love spinach salads or fresh juice, your healthcare provider can help you build a routine that supports both your nutrition and your medication effectiveness. In summary, your medications and your meals are a team, and they need to work together. By understanding how food and drink interact with your blood pressure medications, you can avoid complications, ensure steady blood pressure control, and give your heart the support it deserves. One thoughtful bite and one mindful sip at a time. Mistake number 3. Stopping blood pressure medications abruptly without medical supervision. Among all the medication mistakes older adults make, few are as dangerous or as misunderstood as abruptly stopping blood pressure medication without a doctor's supervision. For many seniors, the thought of quitting seems logical. After all, if your blood pressure readings have been normal for weeks, doesn't that mean the condition is fixed? Or maybe you've grown tired of dealing with side effects like fatigue, dizziness, or swelling, and you want a break. Whatever the reason, stopping on your own can backfire quickly, and sometimes catastrophically. Blood pressure medications are not like antibiotics, where you take them for a set number of days and then stop. Instead, they're designed to work over time to keep pressure levels stable and within a safe range. Medications such as beta blockers, clonidine, ACE inhibitors, or calcium channel blockers adjust how your heart beats, how your blood vessels relax, and how your kidneys handle fluid. Suddenly, removing that support can throw your cardiovascular system into chaos. One of the most dangerous outcomes of stopping medication is rebound hypertension. This is when your blood pressure doesn't just return to baseline, it surges higher than before, often rapidly and without warning. That surge increases the risk of stroke, heart attack, and kidney damage, especially in older adults whose arteries may already be stiff or narrowed with age. Take the case of Everett Shaw, a 74-year-old retired bus driver from Spokane, Washington. Everett had been on a beta blocker for over a year and was proud of his stable numbers. But he started to feel unusually tired and wondered if the medication was to blame. Without consulting his doctor, he decided to stop just for a few days to see how he felt. Within 48 hours, Everett began experiencing chest tightness and blurred vision. His daughter rushed him to the ER, where his blood pressure had spiked to dangerous levels. The attending physician explained that beta blockers must be tapered slowly. Sudden withdrawal can lead not only to elevated blood pressure, but also to arrhythmias, chest pain, and even heart attack. Everett's story is not unique. Studies show that up to 1 in 4 older adults have stopped their blood pressure medication at some point without telling their doctor, often because they felt better, wanted to try supplements, or were influenced by online misinformation. But what many don't realize is that the reason they feel better may be because the medication is working. And yes, side effects are real. Some medications may cause dizziness, fatigue, frequent urination, or swelling. But stopping the medication completely is rarely the right first step. Instead, the best approach is open dialogue with your healthcare provider. Most of the time, they can adjust the dosage, switch to another class of drugs, or explore other supportive options like lifestyle changes. The goal is always balance, managing your blood pressure while maintaining your quality of life. If you're considering alternative therapies, such as herbal supplements, dietary shifts, or stress reduction techniques, it's essential to involve your doctor in that conversation. While many natural approaches can be helpful, they should complement your treatment plan, not replace it without supervision. Family members and caregivers also play an important role. Many seniors are hesitant to bring up concerns about their medications or may quietly skip doses without telling anyone. A quick daily check-in, or simply asking how they feel about their treatment, can make a difference. Encouraging loved ones to share their concerns with a doctor can prevent silent withdrawal and the serious consequences that often follow. In summary, quitting blood pressure medication on your own is never a safe decision, no matter how good you feel or how normal your numbers look. Only a healthcare provider can determine if your medication should be reduced, changed, or discontinued, and that process must always be gradual, structured, and closely monitored. Your medications are there to protect your heart, your brain, and your future. Don't let a sudden decision undo months or years of progress. Let your doctor be your partner in the process, not an afterthought. Your life may depend on it. Mistake number 4, taking blood pressure medications at the wrong time of day. For many older adults, taking medications becomes part of a daily routine, something you do automatically, often alongside meals or other morning rituals. But when it comes to blood pressure medications, timing isn't just a matter of convenience, it's a matter of effectiveness and safety. Taking your medication at the wrong time of day can lead to poor blood pressure control, increased side effects, and even higher risk of cardiovascular events during the early morning hours, when the body is naturally more vulnerable. Blood pressure follows a natural rhythm over the course of a day. In healthy individuals, it dips at night during sleep and begins to rise in the early morning as the body prepares to wake. However, in many seniors, especially those with hypertension or underlying heart conditions, this morning surge in blood pressure can be exaggerated. It's one of the reasons why heart attacks and strokes are more common between 6 a.m. and 11 a.m. If a blood pressure medication is taken too early or too late, it may not be active in the body during this critical window. That's why recent research has suggested that certain blood pressure medications, particularly long-acting ones like ACE inhibitors or angiotensin receptor blockers, may be more effective when taken in the evening. This approach helps control blood pressure overnight and blunt the morning rise, providing more comprehensive protection around the clock. Consider the story of Malcolm Pierce. a 78-year-old from Baton Rouge, Louisiana, who had been faithfully taking his medication every morning for years. Despite this, his blood pressure readings remained erratic, especially in the early hours. After consulting with his doctor and adjusting the schedule to take his medication after dinner instead of breakfast, his readings became more stable, and his energy levels in the morning improved noticeably. Malcolm's experience isn't unusual, and it highlights how a small shift in timing can make a big difference. Of course, not all medications should be taken at night. Some, like diuretics, commonly known as water pills, are better suited to the morning to avoid excessive nighttime urination and disrupted sleep. That's why it's so important to ask your doctor or pharmacist about the optimal timing for each specific medication you're taking. Another common mistake is taking all medications together, even when some should be spaced out to prevent interactions or to ensure proper absorption. For example, calcium supplements or certain antacids can interfere with the absorption of some blood pressure drugs. Without understanding how these substances interact, seniors may unknowingly reduce the effectiveness of their treatment. To avoid timing mistakes, create a personalized medication schedule, ideally with your provider's help. Write down when to take each pill and whether it should be taken with food, on an empty stomach, or away from other medications. If you're managing multiple prescriptions, a medication management app or a detailed pill organizer can be a helpful tool. In summary, timing matters more than most people think when it comes to blood pressure medications. Aligning your doses with your body's natural rhythms and avoiding conflicts with other pills or meals can lead to smoother blood pressure control, fewer side effects, and better protection against serious events like stroke or heart attack. It's not just about taking your medication, it's about taking it at the right time, every time. Mistake number 5, mixing blood pressure medications with over-the-counter drugs without professional advice. When most people think of medication risks, they think of prescription drugs, and understandably so. But one of the most dangerous and underappreciated mistakes seniors make is mixing blood pressure medications with common over-the-counter OTC drugs, assuming that because something is sold without a prescription, it must be safe. Unfortunately, that assumption can lead to dangerous consequences, especially for older adults managing hypertension. The truth is, many OTC drugs can interfere with the effectiveness of blood pressure medications, or even raise blood pressure on their own. This is especially concerning because seniors often rely on these products to manage everyday discomforts such as headaches, colds, arthritis pain, or indigestion, without realizing the hidden risks. One of the most important groups to watch out for are non-steroidal anti-inflammatory drugs, NSAIDs, like Ibuprofen, Advil, Motrin, Naproxen, Aleve, and even high-dose aspirin. While these medications can be effective for pain and inflammation, they can also cause the body to retain sodium and water, which increases blood volume and puts additional pressure on blood vessels. NSAIDs can also reduce the effectiveness of blood pressure medications such as ACE inhibitors, diuretics, and beta blockers, creating a double impact that raises blood pressure while weakening the medicine meant to lower it. Consider the story of Hazel Dorsey, a 76-year-old from Dayton, Ohio, who had her blood pressure under control for several years. When joint pain from arthritis flared up, she started taking over-the-counter Ibuprofen 3 times a day. Within a week, her blood pressure readings began creeping up. She also noticed more swelling in her ankles and occasional dizziness. When her doctor reviewed her recent habits, the connection became clear. The NSAIDs were interfering with her medication and elevating her pressure. After switching to a different pain management plan, Hazel's numbers returned to a safe range. But NSAIDs aren't the only concern. Decongestants found in cold and allergy medications, particularly those containing pseudoephedrine or phenylephrine, can constrict blood vessels and raise blood pressure significantly. These ingredients are common in products labeled as non-drowsy or maximum strength. Seniors with hypertension should always check labels carefully and consult their healthcare provider before using any cold or flu remedy. Antacids, laxatives, and certain supplements can also pose problems. For example, calcium, magnesium, or aluminum-containing antacids may alter the absorption of blood pressure medications if taken too close together. And some herbal remedies, like licorice root, ginseng, or ephedra, can dangerously spike blood pressure or interact with prescription medications. So, what should you do? Always approach OTC medications with the same level of caution as prescriptions. Keep an up-to-date list of all the medications and supplements you take, including vitamins and herbal products, and share it with your doctor or pharmacist. If you're considering taking something new, ask first, especially if you're already on blood pressure medication. Even better, try to manage common ailments with non-drug approaches whenever possible. For pain, consider physical therapy, warm compresses, or gentle stretching. For colds, rely on hydration, rest, and saline sprays instead of decongestants. And for digestive issues, dietary changes may work better and safer than over-the-counter fixes. In summary, mixing blood pressure medication with the wrong over-the-counter product can quietly undo all the progress you've made. For seniors, the margin of safety is often smaller, and vigilance is essential. Don't let a simple cold pill or pain reliever interfere with your heart health. When in doubt, ask before you take. Managing high blood pressure is a lifelong journey, one that requires not only the right medication, but also the right habits, awareness, and support. As we've seen in today's video, even small mistakes in how you take your blood pressure medication can have major consequences, especially for seniors whose bodies are more sensitive to changes in dosage, timing, and interactions. From skipping doses or stopping pills without guidance, to taking medications at the wrong time or mixing them with the wrong foods or over-the-counter products, these are not rare accidents. They're common missteps that often happen quietly, with the best intentions. And yet, they can lead to poor blood pressure control, increased risk of heart attack or stroke, dizziness, falls, or long-term organ damage. The good news is that every one of these mistakes is preventable. By taking a more mindful and informed approach to your prescriptions, you can protect your health and extend the benefits of your treatment far beyond just the numbers on a monitor. Start by building consistent habits, communicating openly with your healthcare team, and keeping a detailed list of all medications, including supplements and OTC items you use regularly. Don't be afraid to ask questions, whether it's about food interactions, proper timing, or safer alternatives. And remember, feeling good isn't a sign to stop your medication. It's often proof that the medication is working. Trust your care plan, but don't hesitate to speak up if something doesn't feel right. Small adjustments made with your provider's help can make a big difference in how your body responds and how well you feel. If you found this video helpful, please like, share, and subscribe to Active Healthcare, where we empower seniors with simple, science-based health strategies that protect your heart, your independence, and your quality of life. Because managing blood pressure isn't just about lowering numbers, it's about raising your confidence, awareness, and ability to live fully at every age.